Welcome back to the channel. Today we're diving into an important health topic that can cause some serious discomfort: peptic ulcers. We're going to break down everything you need to know, from what they are and what causes them to how they're diagnosed and treated. So if you're ready to learn how to keep your stomach happy and healthy, stick around for these 8 crucial things you need to know about peptic ulcers. Let's start with the basics. Imagine your stomach lining like the interior wall of your favorite coffee mug. A peptic ulcer is like a little sore, a break in that smooth lining. Now this isn't just a little scratch. These ulcers can actually extend all the way through the lining, creating some pretty uncomfortable symptoms, and while they're most common in the stomach itself, they can also pop up in the upper part of your small intestine, known as the duodenum. Now you might be wondering, what causes these pesky ulcers? Well, one of the most common culprits is a bacteria called Helicobacter pylori, or H. pylori for short. Think of H. pylori like that unwanted guest who just won't leave your stomach alone. It weakens the protective mucus layer in your stomach and duodenum, leaving them vulnerable to damage from stomach acid. And boom, you've got yourself a peptic ulcer. While H. pylori is a major player, it's not the only thing that can lead to peptic ulcers. Certain medications, particularly non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and aspirin, can also increase your risk. Now, I know many of us rely on these medications for pain relief, but if you're taking them frequently or long-term, it's essential to be aware of this potential side effect and talk to your doctor about ways to mitigate the risk. Chapter 4. Recognizing the symptoms. Now, how do you know if you might have a peptic ulcer? Well, there are a few telltale signs to look out for. One of the most common is a burning pain in your stomach, usually occurring between your breastbone and belly button. This pain can sometimes wake you up at night, and it might feel worse when your stomach is empty. Other symptoms to watch for include bloating, feeling uncomfortably full after eating, heartburn, nausea, and even vomiting. The importance of early detection. It's important to understand that peptic ulcers are not something to ignore. If left untreated, they can lead to some pretty serious complications. These can include bleeding in the stomach or intestine, a perforation or hole in the lining of your stomach or duodenum, and even blockages in the digestive tract. These complications might sound scary, but trust me, early detection and treatment are key to preventing them. So, how do we figure out if you have a peptic ulcer? Well, it starts with a visit to your doctor. They'll ask you about your symptoms, medical history, and any medications you're taking. To confirm the diagnosis, they might recommend a procedure called an endoscopy. This involves inserting a thin, flexible tube with a camera attached into your esophagus, stomach, and duodenum, allowing your doctor to get a good look at the lining and check for any ulcers. The good news is that peptic ulcers are treatable. If your ulcer is caused by H. pylori, your doctor will likely prescribe a combination of antibiotics to knock out that pesky bacteria. Additionally, they'll probably recommend medications to reduce the amount of acid your stomach produces, giving your ulcer a chance to heal. These medications might include proton pump inhibitors, or PPIs, or H2 blockers. Now let's talk about prevention and long-term management. While medication plays a crucial role in treating peptic ulcers, lifestyle changes can make a big difference too. Limiting your intake of alcohol and caffeine can be helpful, as these substances can irritate your stomach lining. And if you're a smoker, quitting is one of the best things you can do for your overall health, including your stomach health. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more health tips and information. Remember, knowledge is power when it comes to your health. If you're experiencing any of the symptoms we've discussed, don't hesitate to reach out to your doctor to get checked out. Stay healthy.